What if you have tried pelvic floor exercises, pessaries, vaginal inserts, all sorts of non-surgical treatment options for your urinary leakage, and things are still not improving? What next? Now, depending on what kind of urinary leakage you have, whether it's stress incontinence, which is leakage with laughing, coughing, sneezing, or overactive bladder, which is urinary urgency, frequency, not being able to make it to the bathroom, nighttime urination, there are surgical procedures. And I say procedures because truthfully, even though we call them surgery, they're basically minimally invasive procedures. They're each less than 15 minutes. Majority of the times they're done as same-day procedures, which means patients go home the same day. So for my patients who are suffering with stress incontinence, there are procedures like urethral bulking or a sling procedure, and my patients who are suffering with overactive bladder, there are options such as Botox that we can inject into the bladder, as well as something called sacral neuromodulation, where we essentially put a tiny pacemaker to help your bladder control going all the time. So moral of the story, if you have tried all the conservative measures, don't be scared to try the next option, which usually is procedures. Make sure you see a urogynecologist or a female urologist who is trained to talk to you about all these options and come up with a plan that works for your particular situation. For more details about these conditions, subscribe to my YouTube channel as well as sign up for my newsletter for weekly pelvic health tips.